And Dr. Darien Sutton, of course, joining us now in for Dr. Jen. A lot of people want to know, can men be diagnosed with breast cancer? And if so, how can they be screened?
Great question.
Yeah, I saw that this morning on our viewer question. I thought it was an important question. Of all the cases of breast cancer, if you look at the statistics, about 1 in every 100 cases of a new diagnosis of breast cancer is a man. And the symptoms can be variable. It can include pain, nipple pain, skin changes. Unfortunately, there is no screening method for men, mainly because the risk is extremely low compared to women. But if you have a high-risk family history, for example, a first-degree relative with breast or ovarian cancer, and you have symptoms, you might want to talk to your provider just to get an initial screening. Men can get mammograms as well.
What are the symptoms for men?
Same symptoms that we talk about for women. So that includes a mass or a lump that you can detect just on your self-exam. If you have any changes in the skin around your nipple or on your chest at all, these are reasons why you should get at least a clinical exam, and you may need a mammogram or an ultrasound or other forms of imaging.
We know it can be kind of uncomfortable to talk about this, but it's so very important, so thanks for addressing it.
Of course.
All right, your prescription for wellness.
How to be a great advocate. I think on the topic of breast cancer, when I walk into a room and I see more than one person, I get excited and relieved because I know that there's going to be more than one person listening. And that's what brings us to our first step, being a good listener. When someone has a diagnosis, oftentimes we try to interject with our own feelings, our own opinions, and then sometimes you really just simply have to be quiet, sit on your hands, and allow them to talk. Also, helping to be a caregiver, running errands, simple things like getting groceries and helping them with getting their prescriptions. You think that that's a small task, but it does take a lot of weight off of that person. And most importantly, respecting decisions. Again, we often want to interject and apply our own thoughts of what we think works for us. But you just have to let that person live their life and open up space for them to release their feelings. I think it's the most important.
Be supportive and patient.
Yeah, I've heard some people say that it's important to not just ask what do you need, but just go out and do something for someone. Sometimes they don't know what they need until it's there, and they're just appreciative that
volunteer to help.
They have that support.
Yeah, sometimes people just need that company, you know, and many times I'll see an advocate ask a question, can I record this this interaction just to help them remember later? And I always say, absolutely. I think it's just so wonderful when I see an advocate in the room.
All right, Doc, thank you. And folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions at ABCGMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.